You ever had that painful, scratchy, dry throat accompanied by nasal congestion or other findings? You wouldn't be alone. 13 million people a year in the US go in with complaints of throat pain. And it's probably one of the most common reasons. In India, it's very common. And today we're going to find out what causes that. How do you treat it? How do you diagnose it? And what's the prognosis? So join me on the channel, and I look forward to talking to you. Hey guys, I'm Dr. Nene, a US trained cardiac, thoracic, and vascular surgeon and a general surgeon. As a healthcare innovator and a health tech innovator, I want to empower you to your best health ever. On this channel, we will share evidence-based medicine from all of us to you through our experiences and training about health and healthcare. The goal is to help you make informed decisions about your own health as well as that of your loved ones. We're here for you, so don't hesitate to reach out. Most sore throats are caused by infections, and I would say 90% of those are caused by viruses. In addition to that, there are a number of other causes for sore throats that include bacterial infections, include allergies, include environmental factors like smoke or irritants, include dry air, injury to the neck or the head, include gastroesophageal reflux disease, and in the worst case, it can be caused by cancer, but that's very, very rare. If you were to take all sore throats put together, 90% of them are caused by viruses. And those viruses can be anything from COVID to the common cold, to mononucleosis, to a variety of others. Below that, and the one which I worry about also, is bacterial infections. And in particular, strep is something which we think about because it can lead to other problems like damage to your heart valve when it cross-reacts with some of the tissues in the heart valve, leading to long-term rheumatic heart disease. And so that's one, if you diagnose, you can treat. The good news is most sore throats are self-limited and will get better on their own. So let's go to the next step. What do we think about with sore throats? There's three main areas they affect. The first is pharyngitis. This is the area behind the mouth, which can get inflamed, bright and red, and very, very painful to swallowing and also talking. Next is tonsillitis, where the tonsillar pillars, which are actually lymphatic tissue that normally filters out bacteria and viruses and presents it to the immune system, gets inflamed. And what you'll see is the tonsillar pillars in the back of your mouth getting bright and red, sometimes having white spots or debris on them, particularly in bacterial infections, or alternatively just being very, very red and hot and painful when you swallow anything. Then the last thing I worry about is laryngitis, where your voice box actually gets inflamed. And in that case, just the act of talking or breathing in some cases can be very, very painful. In most of those cases, the key is to figure out what it is. And if we're seeing you in the office for something like that, the first thing we would do is examine you by taking a look at your throat. But before that, get a good history where we find out if you've had any other problems. The real question is, when do you need to go in to see the doctor? And in my book, I think the most common reasons you would go in is if it's associated with a fever, if you have joint pain or body aches, or if you have other symptoms which don't go away by themselves within 1 to 2 days. Because those things could be something which needs to be treated and certainly seen by a doctor. Now, you've got a sore throat. What can you do about sore throats? Most of the treatment is symptomatic in the way of warm liquids, in the way of gargles with a half to 1 teaspoon of salt in water, or betadine gargles with 2% diluted betadine in water. In addition to that, you can use popsicles or ice cream or other things which will cool down the throat area. And then you can take symptomatic care for any other symptoms in the way of paracetamol or Tylenol or over-the-counter treatments. If by chance you see that you have white spots in the back of your throat, you need to go in. Because what the doctor can do is something called a rapid strep test, where they swab the back of your throat to see if you have a type of bacteria called streptococcus. Why that's important is because it's very treatable. Remember, when do you use antibiotics? In the case of bacterial infections, not in the case of viruses. In fact, in a bacterial infection like strep, it's been known to decrease the duration of the virus and the duration of the symptoms by 1 day, but more importantly, in 2/3 of the patients, it will prevent you from having complications or more if it's treated early enough. In the case of viral cases, in most cases, the antibiotics will not help. And only if you develop complications in the way of pneumonias or other things will you need the antibiotics. Finally, how do you prevent this sort of thing? Like I've said before, masking helps. We learned in the pandemic and in COVID times that when you masked, you never really got sick from other things, let alone COVID. The second thing is making sure that if there's people around you who are sick, staying away from them. And one of the biggest problems I have is that a lot of us are hardworking pushers who push ahead in spite of being sick. And honestly, all of us have had them. The good news is most of them are self-limited and will get better with time. But the key is to know when to see the doctor, when you need antibiotic treatment, and how long to wait with just conservative care. And we've kind of identified those in the video. If you like what we're saying, hit the like button. Remember to subscribe so that you'll get the newest videos that we produce, and share this with everyone so that they can understand this process too. Because in my book, I think awareness and access to world-class medicine is key. Finally, hit the bell icon so that whenever a new video pops up, you'll know about it. Thanks for joining us, and I look forward to seeing you next time.